Five. So thank you so much for everybody for being on and for sticking with us for the past 2 days as we discuss these partnerships. What I would like to do now is switch gears a little bit. Is in the last panel really set this up really quite well. Is discussing now not just how you create these partnerships and what these partnerships look like, but how do we move these partnerships from a point of planning and piloting to a point of sustainability? And that in itself is a really hard thing to do, as we discovered as we were embarking on this project. And with that said, and as we go through this presentation, one thing I would like to also put on the top of everybody's minds as we're thinking about this and thinking about what we found on the funding side is to recognize the newness of these partnerships. And the last panel really talked about that and brought that up. If some of these partnerships are months old and a few of them have been around for 3-4 years, but these are really partnerships that are budding and moving forward. And what we intend to do and what we would like to do with this next panel is to talk about how we can keep them and how we can keep them moving forward and keep that momentum going. So not only are they sustainable, but they're also scalable. So one of the things that we have to really also think about when we think about food banks and these healthcare partnerships is the incredible diversity of food banks within our state. The last panel talked about it, and it's like we purposely set up this segue. We have food banks that are serving an incredibly huge area in Texas, who are serving a lot of counties and who are serving just a spectacularly large area of land. And these food banks who are serving these huge areas have additional costs associated with serving huge areas. They have to pay for gas and the drivers and the trucks. And the logistics of serving these areas are really quite great. The other thing that contributes to the huge diversity that we have in food banks across the state as well is looking at their budget. So we've kind of put this budget together, and I want to say very clearly that this is pre-pandemic of what we found pre-pandemic based on nonprofit filings, and looking at from their nonprofit filings, what is their budget per food insecure person. And of course, what you see is this huge diversity going on here as well, where one of our food banks has a very low budget for food insecure person. And we also have other food banks who appear to have very high budgets for per food insecure person. And when you look at these numbers, you're like, oh, hey, they look like that they could serve. But what's wrapped up in this is that this budget is not just for food. It takes a lot of people. It takes a lot of logistics. It takes trucks. And importantly, especially as we see these rising costs, it takes gas as well. And so it's important to also understand that how food banks get their money. So this panel is really going to focus on those sources of donations, those sources of funding, and how they're utilizing those funds, how these funds can be leveraged and utilized in these healthcare partnerships. So federal governmental grants that we've been looking at are these grants that are coming and filtering to this through the state from the federal government. So the federal government gives block grant funding to either the Texas Department of Agriculture or the Health and Human Services Commission. And from that block grant, then they filter it down either through Feeding Texas or directly into the food banks to receive these funding. And our first panelist is going to talk specifically about TFAP, which is the Emergency Food Assistance Program. I also want to point out once again this huge diversity across our food banks of how the percent of TFAP funding that is a part of their annual budget pre-pandemic. And for some of our food banks, we're looking at 6 to 94% of all of their federal granting comes from TFAP. For other food banks, it's really, really low. And this great diversity in funding and this great diversity in this funding mix for each of our food banks impacts how they fund these partnerships as well as the sustainability of these partnerships. The other funding source we're going to also discuss a little bit more in our panel is SNAP-Ed. SNAP-Ed comes through the Health and Human Services Commission and goes directly into Feeding Texas, and Feeding Texas then helps distribute it through the food banks. We're going to talk about that quite a bit this afternoon. But to focus on SNAP-Ed, SNAP-Ed is really about education and not about food. So when we talk about those nutrition programs, SNAP-Ed becomes a big part of how these nutrition programs and nutrition education programs get funded. Donations are probably the biggest contributor to food bank funding. And JC Dwyer is going to talk a little bit more about that as well. But between our federal governmental grants and our donations, this is really the bulk of how our food banks are buying their food. Our food banks are funding their staff and are funding these partnerships. So the other thing that we see happening is, of course, food banks, and this came up quite a bit on our other panels, also receive other grants and are seeking out other granting opportunities, applying to other granting opportunities, or the grantor is coming back to them and asking them, hey, will you do this project? And so there's a lot of grants that are coming into philanthropy. And I know that this is going to come up as well. Our MCOs and our insurance companies are also helping fund some of this work, which you heard about on the last panel. But the thing I would like to point out is that most of that funding that we see coming through our MCOs and our insurance groups into the fund, especially these healthcare partnerships, are coming through the charitable arm of the MCO or the insurance group. And so we're going to talk about that in a little bit as well. As was brought up yesterday, county and municipal funds are also going into our food banks as well and being utilized for some of these important education programs. And then Feeding America also provides seed funds to the food banks. These other grants that are coming through, though, are a smaller proportion, based on what we've seen, a smaller proportion of the food bank funding than donations in the federal governmental grants. And these tend to be things that, like I said, are one-off and limited time funds, although some of them have found some sustainable funding through them. One of the things that also we're going to be talking about is there's also some state funds within Texas. Texas doesn't have a lot of state funds that are dedicated to helping food banks. And this is state general revenue funds, not federal funds filtered through the state. There's not a lot of general revenue funds that go to support food banks. But one major area that does go to support food banks is through this produce recovery program. And we're going to talk more about the produce recovery program as well. We see this as a really important aspect of food banks and especially helping with these partnerships. So what needs to be funded? And I think when we started this project, that became one of the things that we wanted to really look at, because I think on the healthcare side, there's not a good understanding of how much a food bank gets stretched in these projects, or how much a food bank needs to bring resources to the project. And on the healthcare side, on the food bank side, I'm not sure how it's quite the same of what is the impact on the healthcare side. So on food bank, people, of course, have to be funded. I think that becomes clear, that everybody knows that people have to be funded. We need to dedicate FTEs to these projects, or else the projects won't happen. Food needs to be funded as well. But the thing I think that we leave out is logistics. And the last panel did a great job talking about this and bringing this up as something they had to overcome as they were setting up their healthcare partnership. Food has to get from point A to point B. And that requires a lot of logistics. It requires drivers, it requires trucks, and it requires gas. And anybody who's filled up their gas tank of late knows that these costs are also increasing, not just the cost of food. So the logistics of getting the food from the food bank to the healthcare partner, that's an important aspect that also needs to be funded on the food bank side. The other thing that we saw that came in on the funding side too is systems. Food banks have their systems for tracking. It was brought up in the last panel. There are a couple of systems out there, Charity Tracker, as well as a couple of others, where the pantries and the partner organizations are reporting back to the food bank about who is receiving boxes, who is receiving food, and especially if they're receiving federal food, whether or not all the qualifications and the screening for them being qualified to receive that federal food and that USDA food. One of the things that we have seen come up in terms of systems is that a thing that must be added onto these on the food bank side is HIPAA compliant systems. That food banks may have really great systems in place, but they're not necessarily HIPAA compliant, so it's hard to integrate them on the healthcare side. But yeah, on the healthcare side, there's also important things that have to be funded too. People, of course, have to be funded, and a lot of healthcare, especially healthcare clinics that are serving low-income populations and really high-risk populations, they're running a lean, mean, tight ship. And so they probably need funding for that social worker, that navigation specialist, the nurses to go out and help with the health screenings. There's funding on the people side, on the healthcare side too. And that people side may not be people that healthcare have on staff at that moment. And there's another thing with healthcare too is systems, and to not, Melanie brought this up yesterday in the work that they did in San Antonio, turning on, it's EHR, word likes changing EHR, sorry. But turning on those modules, even when you have Epic, costs money. And integration within the flow of the way that it's set up in the clinic, that takes time, that takes training. And like I said, it takes money to turn on that food insecurity screening module. So this systems issue also turns into a time issue and a funding of time. And finally, infrastructure. And this was brought up on the previous panel as well, that in infrastructure, if a clinic wants to become a pantry, they need the food safety infrastructure within the clinic. They can't just sign up and become a pantry. They need a place to store the boxes and store the food. And if they're asking for produce or other perishables, they have to have the refrigeration space as well. So this is also a capital infrastructure investment on the side of healthcare to be able to stand up some of these particular models. And I would like to acknowledge that Dr. Smith has also added in evaluation funding on both sides as well. Something that definitely has come up in several of our interviews and projects, that we have seen projects across the state that being able to fund the evaluation of these projects, especially these projects that are just standing up, is also important for keeping these partnerships going and helping these partnerships maintain sustainability. So across these different models, there are also different ways that we've seen these models get funded. I think that of all of these models, these chronic disease management models that we have seen, these are the models that really become like a single way that they get funded. And that goes through specific grants through a lot of these are being funded through healthcare payers, specifically through their charitable arms, through MCOs and insurance. And that is funding the partnership and funding the chronic disease management, either the food boxes or the diabetes education that we see happening at the food bank. For all the other models, our funding sources that we have found through this project, those become incredibly, incredibly diverse. Everybody's kind of bringing together multiple funding streams to kind of put them together, or they're receiving one off in one way, but then everybody's bringing a little bit to the table through other partnerships. So the pop-up distributions and these health fair type distributions that we see that are partnerships between the food banks and healthcare, that's where we really see funding coming in on both sides. A little bit is brought in on the food bank side and a little bit is brought in on the healthcare side. And they're really investing in this on both sides, both with time and with money. But we also see that there's a variety of time-limited grants that are funding these pop-up distributions as well, not just grants like we heard about on the previous panel. For co-located pantries, we're seeing also a variety of time-limited grants. The panel that we heard before, that was being funded through an MCO, through also one of their charitable arms. We hear that a lot. One of their other co-located pantries, the startup for that pantry, was actually funded by the parent organization of the healthcare clinic. So there's a lot of variety of places where this funding is coming in. And what we have really found is there's a variety of strategies to fund the food. A lot of our our food bank partners have said they try to not include TFAP food because they don't want the strings attached. But yet we've had others that say we want to bring in the TFAP food because that is a healthy commodity that we know is sustainable. So with that said, as we look through these models, as diverse as these models is, the funding for these models is just as diverse. And so one of the things that is very, very telling, though, that we haven't seen when it comes to how these partnerships are funded is that we are not seeing food banks say that they are seeking reimbursement for their education, especially education programs. And in particular with the education programs, they're ADA compliant and ADA certified. These are eligible for reimbursement through Medicaid or other insurance providers, and food banks are just not doing and seeking that reimbursement for a variety of reasons. And so that is something interesting we're not seeing. The other thing that we're not seeing is managed care organizations contracting with the food bank to provide services specifically for their clients. When we see and like I said, we see a lot of managed care organizations stepping up with funding for these partnerships. That funding tends to be not in their direct patient side of things, but actually in their charitable side of things or their marketing side of things. So managed care organizations with the funding, while they're really helping support this, they're not integrating it into their normal streams of revenue when they fund these partnerships. So there's a consequence to this too, is one of the things that we see is there's a lot of pilots happening across the state. And some of that has to do with the newness of these partnerships. So I don't want to discourage having these pilots and having these one-time limited funds to do this work. But it does, these conversations do come up in some of our interviews about the food bank side wondering how they're going to keep this going. And if their funder is going to come back next year and say, oh yeah, let's keep this going. So consequently, there's a lot of pilots happening across the state. One of the other things that we see that happens is that in some of these, especially with the purchased food and specialized purchased food for specifically that partnership, we see an increased labor for purchasing food. And this was also alluded to in the last panel, that when, and that's important with that increased labor, that's going to impact the food bank and the food bank's functioning. The other major consequence is just grant writing. We see a lot of and heard a lot from our food bank partners that they spend a lot of time doing grant writing because as one ends, they need to write a grant for another, even when they're being approached to do the work. You still have to write the grants, and you still have to. And I know this very well, you still have to write the grants and you still have to say what you're going to report. And that also leads to grant reporting and lots of grant reporting. So this also splits labor within the food bank and on the healthcare side, is that it splits labor so that instead of focusing on the provision of these partnerships and fostering the partnerships, we're focused on reporting about the partnerships. So while it's hard to talk about sustainability with the newness of some of these programs, I do think that we have seen lessons of what looks sustainable when it comes to the funding. And one of the things that we see that it's sustainable is when on the food bank side and on the healthcare side, the programs are integrated into existing workflows. And then when the programs are integrated into existing workflows, it feels when we talk to the food banks and talk to the healthcare partners, this sounds like it's what it leads to sustainability. One of the things that we also see is when the funding is when we have directed and strategic time limited funding. So time. Like I said, right now we're in the situation of most all of the partnerships that we have talked about. While their funding may be stable, it is funding outside. It is time limited funding, with the exception of a couple. And but when we see that directed and strategic time limit funding is pointed at things that are one-time costs or don't have a lot of maintenance. Other trucks have a lot of maintenance, but the cost dedicated to purchasing trucks to help with the logistics or purchasing time for drivers, that helps with logistics as well. Directed funding at improving and increasing systems on both sides. We see that feels and listens, and when we talk to our food bank partners, that's what sounds like it's sustainable funding. And partnerships that feel like they're going to grow and scale. So I'm going to stop there. This is our contact information, and I'm going to stop sharing. And I would like to invite JC Dwyer up. JC is with, hi JC, there he is. And JC is with Feeding Texas. And JC, I'm going to let you introduce yourself and talk about what you do.
Sure. Thank you, Dorothy. Hi, everyone. I'm JC. I noticed there's quite a few number of food bankers on this call, so I don't need to introduce myself to everybody. I've been with Feeding Texas for over a decade. My current role is as senior advisor, and I've had visibility into all the different parts of Feeding Texas over that time. The piece that I've been asked to talk about today is just a little bit more of an overview around those major food sources, particularly the federal and state food sources that could be brought to bear in a partnership like this. I think as Dr. Mandel pointed out, the preference is always for new money, right? Incremental funding that will allow food banks to do more. And so if they're looking to embark on a new partnership or to reach a new area of their their community with food, they would like to see that food come from a new source, whether that's a managed care provider or some other type of healthcare funder or grant maker. That said, there are a number of sources that the food banks currently use throughout their system that, as were mentioned, are fairly reliable, sustainable over time, and that could potentially be integrated into any one of these programs. So I'm going to try to share my screen here.
Yep, it's showing up. Thanks.
Most of the graphs I'm going to show here in this really brief presentation are national level, but the basic trends hold for food banks in Texas as well. And I've called out some Texas specific statistics where valid. When most people think about food banks, and I'm sure you all have already talked about this as part of your convening, but there is a bit of confusion in the nomenclature between food banks and food pantries. Food pantries being sort of the local retail level of the charitable food system, food banks being the more regional, what we'll say, warehouse levels of the system. And in recent years, there's been some gray area there as the food banks have taken on more of a direct distribution role, particularly in parts of their service areas where the traditional brick and mortar of a church-based food pantry doesn't exist. For the most part, still, much of the food that runs through food banks ends up being delivered to families through our network of over 4,000 primarily faith-based partners, pantries, kitchens, community action agencies, those types of organizations. So in thinking about that difference, a local food pantry may access food from a variety of sources, including the food bank. If they are a food bank partner, typically most of their food, upwards of 90%, will come from the food bank, but they may supplement that with donations from other places, local retailers, HEBs, that kind of thing. And that can lead to a different mix of food that you might see at the retail level of the charitable food system than what is provided by the food bank. So to bear that in mind, food banks get their food from a number of different sources. As most people imagine, most of it comes from donations. Over half, in most cases, comes from donations from the public, but it's not typically sort of the bag of food that you drop off during the holidays, or sometimes you'll see a barrel where you can donate, or there'll be a special event like a fill the bus kind of event. Those types of individual level donations, family donations of food, are typically a very small part of what is seen at the food bank warehouse. Most of those donations come from much higher up on the food chain. Growers, warehouses, the sort of more regional components of the food system. Food banks are essentially a mirror of the dominant food system. We have our hand out at every level asking for support and donations. And so when those major players give donations to us in the form of, I'll talk about it a little bit, in the form of produce that's grown but not able to be sold, or warehouse level food pallets that have been kicked for whatever reason, or the buyer has disappeared, trucks that missed their deadline. Those types of major donations make up a big chunk of the donation streams that you're seeing in that blue line there. The federal commodities are also a major source of food for the food banks, particularly in Texas. 30% of the food at Texas food banks comes strictly from federal commodities programs. At the smaller food banks, it's an even larger amount because they don't have as great access to those donation streams I mentioned. And so, at a small rural food bank, sometimes federal commodities can be upwards of 50% of their total food in their warehouse. Those are really important programs. I'm going to speak in a moment about the largest of those, called TFAB. And then finally, food banks supplement what's in their warehouse with purchased food. Obviously, this is food that's purchased bulk for pennies on the dollar based on relationships that we already have with the aforementioned donors and parts of the food system. So it's not like we're going to HEB to buy a bunch of stuff. But there is a small amount of food that we can't find elsewhere that ends up getting purchased so that we can round out our offering at the food bank level. So the largest federal commodity program is known as TFAP. That's an acronym that stands for the Emergency Food Assistance Program. When TFAP was originally created in the 1980s, the T stood for temporary. But as they found that the need did not abate, nor did the opportunity to use USDA to repurpose some of their commodity buying power, this program became a perennial program that's been serving food banks for almost 30 years. It is a part of the annual federal budget. It is part of USDA's budget, and it is authorized every 4 to 5 years in the Farm Bill, which is a reauthorization bill that is actually up for debate again next year, that authorizes a number of nutrition programs, including SNAP. And TFAP is something that the food banks typically advocate for through that bill. But it's a pretty reliable source for the food banks. In no recent farm bill has there been any major changes to the program. And whatever is authorized is typically what is also appropriated on an annual basis by our federal legislators. That budget gets allocated to the states based on the number of unemployed and people living in poverty in that state, based on a formula. And so in Texas, in FY19, and I'm using FY19 here because the last 2 years have been so screwy in terms of both the need, but also the amount of support that food banks have seen from the feds. In FY19, that number was $57 million. So it's a major source for the food banks. That 57 million is then sub-allocated to all of the food banks in Texas based on their service area's share of, again, the number of people who are unemployed or living in poverty. And that process happens through the Texas Department of Agriculture. It's a different state agency in every state, but here in Texas, it's TDA. Food banks contract directly with TDA for their portion of the TFAP grant. And then they can use that portion not as cash. It's not actual money that changes hands. It acts effectively as a line of credit that food banks can use to order food from USDA. USDA maintains a standard offering of commodities that food banks can order over the course of the year. There's also a smaller pot of bonus commodities that the Secretary of Agriculture can use his purchasing power to prop up certain areas of the ag economy. And so those purchases become part of the mix that's available to food banks. And that's really important for the stability of the program because it's not cyclical the way that a lot of donations are. It doesn't come in during Christmas. It's effectively an evergreen source of funding that food banks can plan out ahead of time. And so they can order, a truckload of pinto beans to show up in January and a truckload of applesauce to show up in February, or whatever their needs are according to their plans for that year. The offerings that USDA makes available to the food banks, again, this is the FY19 offering, are typically fairly healthful, shelf-stable foods, either canned or frozen foods. You can see, I hope you can read some of these, this little type here, but it's a pretty good variety. And so that can be put into the mix for any number of programs at the food bank level. Because it is a federal program, it's not something that we can use just area eligibility or other types of broad-based eligibility to qualify people. There does need to be an exchange of paperwork with every eligible household. Typically, this only has to happen once. Once someone is made eligible for the program, they can be eligible for their certification period can be up to a year. And it's a fairly simple application form. As you can see here, this is the Texas form. It's a single sheet of paper. I cut off the second sheet that had a little bit of more explanatory text, but the basic questions we're asking folks are, where do you live? What is your household income? They have to be below 185% of the federal poverty line in a given year. And what is the nature of your household crisis, which just is a documentation thing. All of this is self-attested, so we're not looking for any sort of documentation to back up these numbers, and we're meant to keep these on file, whether electronically or in paper, for the duration of the person's participation in the program. That participation can take many forms, all right? Like I included a picture here of the direct distributions that the food banks have been doing so much of over the last couple of years, both for safety reasons, but also because of the amount of need. I suspect this will be a model that will continue in the future, but of course, there's all sorts of models that the food banks deploy to get food into the community. And as I mentioned earlier, the traditional pantry model is one that has staying power and that will continue to be used. So whether it's in the direct distribution like this line of cars or in a neighborhood church pantry, there's typically at least one person, a volunteer or a staff member, who is checking in people and having them sign one of these forms. So that's a very sort of light amount of paperwork for most federal programs, but it is something that needs to happen in order to access that TFAP food. The second program that I'll give a brief overview of, I think Dr. Mendel mentioned, is a Texas-based program. So this is something that's funded by the state of Texas on a biennial basis. Right now, we get $9.7 million biennially. across the entire state, which goes very fast. It's not a lot of money for all the good this program does, and we're constantly advocating at the legislature to increase that amount. That 9.7 million for 2 years is allocated to the food banks based on the same formula that TFAP uses, unemployment and poverty. And then Feeding Texas is the one that contracts for this program, and we subcontract to our food banks. So that money is more like a cash kind of program. The food banks essentially have funding that they can use, and the purpose of the funding is to help defray the costs of farmers who are looking to sell imperfect produce across the state. Basically, this is produce that is perfectly edible and healthful, but would not meet sort of the beauty standards of a grocer like HEB. And so this funding allows food banks to compete in that sort of imperfect or seconds market by paying growers directly for harvesting and transporting their crop to the food bank, what we call pick and pack out fees. So rather than having to plow it under and wait again for a better market or trying to sell it to some other secondary buyer, they can give it to the food bank, and we can pay them, typically on the order of 10 to 12 cents a pound for really great produce. Typically, on average, we're able to distribute 8 pounds of produce for every dollar in the program. And that also allows us to establish new donor relations with those growers. Like I mentioned earlier, food banks are always looking for new donors at the top of the food chain, and those growers can often make available to us no-cost loads in addition to the loads that we're paying for through this program. So I'd say that this is a program that is fairly stable politically, but one in which we really love to see a much greater investment by the state. And so if any of your organizations do engage in advocacy at the Texas legislature, we'd love to have you on board for this particular plank of our advocacy platform. Just to rebut some of the common stereotypes around sort of the food that's available to food banks, in part based on the food bank's commitment to serving healthful food to the community, and in part based on these programs, which are providing a decent level of healthful food. You can see here, this is a chart for the US, but again, Texas is fairly similar. The largest category by poundage that food banks distribute is produce. 35%, in fact, of the food they made available through food banks in Texas is produce. And you can see in most of these other categories are also things that you would probably deem healthful in most forms. To get a better beat on it, Feeding America, our national organization, has come up with a nutrition-based framework called Foods to Encourage that effectively takes all of those foods that enter a warehouse and ascribes them a score, and then basically says, is this an F2E or is it not? Is it healthful or not? Based on that really binary approach, most food banks score fairly well, especially in Texas. 74% of our total offering at the food banks is deemed a food to encourage. And so that's what's available both for these types of programs and partnerships, but also for the larger community of pantries that provides food to the public. Just want to mention really quickly a couple other sources of food and funds that are smaller. Several of the food banks here in Texas operate a USDA program called the Commodity Supplemental Food Program. This is a fairly prescribed monthly box program for senior citizens. We have at Feeding Texas, a social services outreach program that's funded by the state. So we have an $8 million grant from contract with the state of Texas to resource our food banks to have staff who can go into the community or receive clients at the food bank and help assist their application for federal benefits like SNAP, Medicaid, TANF, and CHIP. Those folks are always looking for opportunistic ways to get in front of more people. And so that's another resource that can be folded into a potential healthcare setting. And then, of course, there's, I think was mentioned earlier, our SNAP-Ed Nutrition Education Program, which is a $6 million statewide contract that allows us, again, to fund staff at the food banks, trained nutrition educators who go out into the community, whether that's a school or healthcare setting or a pantry, and provide direct nutrition education to those folks on the best ways to prepare the foods that we're offering. So those are all different types of resources that can be sort of mixed and matched in any kind of programmatic setting, including the ones we're discussing here today. Obviously, food banks operate in sort of a world of scarcity. There's always more need than we can meet. And so when we are asked to repurpose funds or food to a new venture that really has to fit very squarely within our mission. That said, there are a number of food banks who are thinking very flexibly about ways to get into the community and serve, the folks that we know are out there. And so healthcare partnerships and, doing this kind of work in healthcare settings makes a ton of sense. You just have to realize that these food sources are, competing with other places in the community and other outlets for people to encounter the food bank. And so it really has to make a lot of sense for the food bank to be able to repurpose those foods for a healthcare type of intervention. Dorothy, that's all I have. Was Melanie going to speak?
Yes, she is. And so, Melanie, do you want to? Melanie McGuire is with the San Antonio Area Food Bank, and Melanie, you want to come on and do yours, and then we will. After Melanie's presentation, we'll come back together for questions. And so, JC, if you could stop sharing your screen, that'll help.
I'd love to. Give me a minute.
Good afternoon, everyone. I am Melanie McGuire. I'm our Chief Program Officer here at the San Antonio Food Bank. And I'm here to talk to you a little bit about some of the ways that we've looked at funding opportunities with healthcare partners. Yesterday, I was able to discuss some of the work with our referral program, which is in that kind of space that Dorothy had mentioned around some of those innovation work. But in terms of kind of sustainability and scalability of our work, I wanted to kind of talk about some of the work that we're doing with our healthcare sites. So really wanted to mention two main programs that we operate here at the San Antonio Food Bank and really discuss some of the opportunities for these programs to be leveraged in other food banks and in other markets. One, which is our mobile mercado. This is a retail enterprise that we embarked on back in 2016, and it's essentially a food truck. If you go back, you can see here in this picture what that looks like. We became a SNAP approved retailer in 2017, which is really ensuring that we're going into some of those high need communities where we know that there's lack of resources or retail to be able to provide low income families access to healthy and nutritious foods. We've also have a demonstration kitchen on that truck, which we're able to provide heart healthy, diabetic friendly meals as well. This serves really well during even a disaster response or just in areas where we want to get more meals out to the community. Prepared meals are not a reimbursed service for SNAP, but we oftentimes hear that it's very difficult to cook or prepare meals for individuals. And so the ability to have access to those meals is critical. It's certainly one of those advocacy opportunities that we see in terms of furthering our work in SNAP. We've also been able to leverage this program to include things like prescriptions for produce or fruit and veggie prescription programs with our healthcare partners. It is a costly venture. I will say that from the beginning. For those that are considering embarking on this work, anytime you run a food truck, any food truck provider will tell you it's the gas, logistics, it's the how many places you can be at a given time. And so I have included a link about that, about our program and our work that we've embarked on in that space. But it is a really great way to incorporate both SNAP and the accessibility of SNAP for individuals. Oftentimes we'll hear people who will apply for SNAP, redeem SNAP, but maybe in a community where it's oftentimes difficult to access a location to redeem those benefits. The second program I'm going to just briefly touch on is the Double Up program. And this was a real opportunity that we saw to be able to stretch those SNAP dollars for individuals using our farmers market programs here in San Antonio. This program is obviously not limited to San Antonio, and it's certainly available to our state. And so the opportunity to leverage this program further is something that we would highly encourage. When we think about SNAP here in Texas, and we know that over 3.5 million individuals are on the SNAP. So it's one of, as we mentioned yesterday, a critical safety net program for those that are food insecure, both in terms of accessing those services, but then being able to utilize those services. So the ability for those SNAP dollars to then be really stretched to allow for individuals to access more produce using SNAP. We oftentimes hear from families that say that produce is one of the most costly things for them to purchase, and they're limiting the amount of produce that they purchase at the store simply because of the cost of those items. And so being able to incorporate farmers markets and the Double Up program has allowed more of our participants to access the appropriate quantities of produce that many of these families need, leveraging their kind of purchasing power. One of the other kind of interesting impacts of this program is that it also has a local impact in our economy. Many of our farmer markets are operated by small farmers who have small shops. They're not mass producing produce in this case. And so by being able to participate in the farmers market program, many of them also see an increase in sales and have been able to kind of leverage their own kind of growing. And so really it's a win-win for both our local economy as well as food insecure individuals who are accessing services. Farmers markets end up being one of those really unique opportunities that leverage both a community kind of response, really reduce the amount of stigma that we see around individuals accessing charitable food that oftentimes we hear in some of our other settings. So it becomes really this community-wide event that people can access as they need. And interestingly enough, while we operate many farmers markets, many individuals are not aware that TDA actually, amongst the 12 federal programs they administer, operates 2 programs specifically under this farmers market initiative that allows for the increase of fruit and vegetables through voucher systems. So the first one is our seniors farmers market nutrition program. This is not a statewide program, so not every food bank in every region is operating this program, but there's absolutely an opportunity for increased participation in these type of programs. The second program around the farmers market nutrition program really focuses on caregivers with children. We often here in San Antonio call that our WIC farmers market program because we operate many of those locations at WIC sites. But again, it's really an opportunity to get voucher booklets that are worth up to $30 to these program participants. We know these are areas where we see the highest rates of food insecurity for many of our children. We see alarming rates of food insecurity that are double the average household's food insecurity rate. So really being able to pinpoint and target those interventions. And obviously for our seniors, they're oftentimes those individuals that have the least amount of purchasing power with SNAP. And so being able to leverage farmers markets as another opportunity to increase their purchasing power of fruits and vegetables is really critical in that space. So here's just a list of some of those healthcare partners and other partners that we've worked with in these initiatives. I didn't list them all, but I have included links to both of those programs that our food bank operates. So you can kind of see a list of a calendar of how those programs operate here in San Antonio. But this has been really interesting to be able to embed some of these services directly at healthcare locations. So we have, for example, our Mercado actually goes to the healthcare setting. But we've also operate locations that are nearby healthcare clinics. So we've taken a dual approach. Someone mentioned yesterday about college students, and we've also embedded these programs for college students, particularly in our community colleges where we have families who are furthering their education, but may also have children who can also participate in those type of programs. And then here's a couple of highlights around our farmers market programs this year. So here in San Antonio, we've operated 94 farmers markets from March to October, which is our farmers market season. And then I've given you a little bit about our distribution of voucher rates and our redemption rates. And so we're really encouraged to see those redemption rates that are really high. There's lots of ways for organizations to participate in this work, both to be able to help ensure that individuals are receiving these vouchers, but then also to have place-based location settings where individuals can redeem those vouchers. So many of our farmers markets occur in places where people frequently use those services, and they're able to redeem those vouchers directly there. Those could include libraries, healthcare unit locations, faith-based organizations or nonprofit organizations. And then I gave you a little bit around our mobile mercado and our produce prescription programs and the work that we've been able to do in those spaces as well. Finally, this is just a slide. It can be found to look at farmers market locations in the state of Texas. As we mentioned, it's not a statewide program, so there may be individuals and organizations that are operating different programs in the state. But certainly, it's great to see many of these locations increasing access. I know for our double box programs here in 2021, we have 40 participating sites, which is almost double what we've had in the past. So we're really encouraged to see more farmers markets and other access points for individuals to leverage these program benefits. And that's it. If you have any questions, I'll be happy to answer them.
That was fantastic, Melanie. Thank you so much. We do have a question that is from Natalie Markman of North Texas Food Bank. And she said, what's the process of getting Double Up in your local food markets? Because, you know, Natalie and I have talked to you about this quite a bit. We're a huge fan of Double Up programs.
Yeah, we would be happy to work with any food banks that are interested or that are currently operating farmers markets around the process of getting set up as a Double Up entity. There's quite a bit of information online about that process of getting that started if you have an operating market. I will say here in San Antonio, we have two different types of markets. We have markets that we run, but we're also the backbone organization for the Farmers Market Association here in San Antonio. So we help with a lot of the administrative work for the other markets that are run in the community by farmers. And so we just want to make sure that those are also sustainable. So we understand that there's some administration as a result, administrative work is part of that space. And so I'm happy to connect with anyone that would like to pursue that further.